Good day everyone, I'm Desiree Macapilla together with my roommates from DSMPTH, and today we will be presenting the Pulse Point Hospital Information System designed specifically for the laboratory department. So the purpose of this system is we developed this system to address common challenges encountered in the laboratory operations. One of the major problems, we observe several issues in the current laboratory process are still in manual keeping and pre-requisition procedures, which still rely on paper and pen. These traditional methods is time-consuming, prone to human error, and can lead to mistakes or damaged records. It can also cause us delay in processing patients, requests, and retrieving important laboratory information. So why did we conduct this system? This HIS aims to enhance workflow efficiency, data accuracy, and faster service delivery to the patients. So now, let's proceed to the system overview.
The main interface of our system is user-friendly and composed of key menu buttons that guide the laboratory personnel through different functions. These menu buttons include appointments, laboratory schedule, patient pre-requisition form, and medical records. Each function plays a vital role in ensuring a smooth workflow within the laboratory. First is the appointment. When we click the appointment form, you will be directed to a digital form where patients can input their appointment. Next is laboratory scheduling. This section allows staff to organize and assign schedules for laboratory procedure. Next is the pre-requisition form. Patients and doctors are directed to a digital form wherein they can input their information and request laboratory tests. Lastly is the medical record. This section stores all patient laboratory history. For further details and information, it will be presented by Ms. Denise Dakar.
Good day everyone. I will be explaining the patient pre-requisition form and how it works in the system. To begin with, the patient pre-requisition form is mainly used for verification. This form ensures that the patient has already provided all necessary information before they proceed with scheduling a laboratory appointment. In short, it acts as the first step in organizing and confirming patient data, making the entire process more systematic and accurate. Once the patient inputs their ID into the form, the system automatically generates a requisition number. This requisition number is very important because it serves as a unique identifier for each patient. It helps avoid confusion, especially when there are multiple patients with similar names. This number will also be used in other forms, such as the appointment form and the laboratory result form, ensuring that all records are properly linked into the correct patient. Most of the fields in the form are simple and user-friendly. This includes short text inputs for basic information and date fields for scheduling purposes. To make it more convenient, a calendar feature is added so users can easily select the correct date instead of typing it manually. This reduces errors and improves accuracy in data entry. For the status section, a drop-down list is used. The available options are pending and approved. This feature helps monitor the progress of the patient's request. For example, pending means the request is still under review, while approved indicates that the patient is already allowed to proceed with the next step, such as scheduling their laboratory test. Moving on to the patient form, the main focus is still the requisition number. This number acts as a connection between all related forms in the system. When the requisition ID is entered in other forms, It allows the system to quickly identify the patient and retrieve their information. This ensures that all data, including appointments and laboratory results, are properly organized and easily accessible. Lastly, the form includes important functions such as save, print, and add new record. The save function allows data to be stored securely in the system. The print function is useful for generating a physical copy of the form when needed. Meanwhile, the add new record function makes it easy to input a new patient information without affecting existing records. This feature helps improve efficiency and make the system more practical for everyday use. Overall, the requisition ID is the most important part of the patient pre-requisition form because it ensures accurate identification and smooth flow of information across all forms. It helps maintain an organized system, reduces errors, and makes the entire laboratory process more efficient.
And now, this is the tables, forms, and report, or the overview of the inside of the system. Once again, we are one of the group from the BSMT2H Health Information System. We hope that you know about our system that can be useful for further laboratory departments, not just in city settings, but also in the rural settings of the Philippines.